Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
All right, welcome, Mary Parker. Thank you for doing the program today.
Yeah.
And I'm turning it over to you for an awesome presentation on oral nutrition supplements.
All right. Thanks, Lauren. So as she said, I'm one of the oncology dietitians here at Northside. Today we're going to talk about oral nutrition supplements. And let's see. There we go. A few little objectives just to kind of give you an idea of what we're going to be talking about. We're going to review where to find protein on a food label. We're going to kind of distinguish between the various oral nutrition supplements found on the store shelves and which ones might be best suited for your personal nutrition goals. We're going to learn about other supportive oral nutrition supplements besides your typical protein shakes. And we're going to also get into talking about the differences between juicing and smoothies and, kind of how to make sure if you are doing juices or smoothies, making sure that the smoothies you're making and things are balanced if they're going to act as a meal replacer. So as I go through the different products, I'm not necessarily endorsing like one specific brand or type, but I just kind of, in the slides, I'll have a lot of different options listed, just because depending upon where you are, where you grocery shop, certain ones might be more available than others. So starting off, protein, and a lot of people here, kind of think about oral nutrition supplements as like a protein shake or so the main thing with those is when you're looking at a nutrition label, over on I have kind of an example of what a nutrition label looks like for those of you who really may not have taken a deeper look at one before. But it has protein listed towards kind of the bottom of the label, and it'll tell you how many grams of protein is in each serving. So protein's important for building and repairing cells. It's important for maintaining muscle mass. It helps to regulate your hormones, and also it aids in digestion. So again, when looking at a food label of a protein shake you're trying to determine, or just any food label in general, the protein's going to be listed towards the bottom of that label. Everybody has a different protein need for them. It's based off of weight. But a general rule of thumb is your protein intake should be about 10 to 35% of your total calories. So, that's how you can kind of figure it out. But all of you should have access to a registered dietitian, and where we can kind of sit down one-on-one and give you your calorie needs and protein needs specific for your weight and your goals. So that's just a little bit about protein and where to find it on the label. So again, I kind of introduced what oral nutrition supplementation is, but there are a lot of different drink ideas. So this is anything that you can kind of drink that's mainly liquid at room temperature, not solid food, like not a solid meal. So milk, fruit juices, homemade smoothies, milkshakes, and then you can buy your pre-bottled options as well. And I'm going to go into some more depth on the different options as we go. So you don't worry about, I'm going to go over all of these in more depth. So if your goal is to gain weight, so if you have been losing weight through treatment, or desiring weight gain. Typically the label will say something like plus or complete or very high calorie. Also, when looking at that nutrition label, you want the options that aid with weight gain typically have maybe around 200 to 300 or 250 to 300 plus calories per bottle and about 15 grams of protein or more per serving. So again, if you're looking for an option to help you gain weight or to use something as like a meal replacer, let's say that you are having a hard time swallowing solid food, so you're needing to drink a shake instead to replace a meal, then your shake on the nutrition label needs to have at least 300 calories and at least about 15 grams of protein per bottle. So that's considered kind of a meal replacer. Again, these are just, like I said, one product is not better than the others, but these are just some options that you might be able to find. You know, there's the generic brands of things like Equate at Walmart, Kroger brand, Publix brand, all of those typically are the same ingredients as your name brand. The one thing that I always like to point out too is that even though these shakes are milky in they have and I have a slide later on plant-based shakes, but basically even though they are milky in nature, they have the lactose removed, so they're lactose free. So if you have a lactose intolerance, then these shakes are okay for you. The only time we would say you may need to find a different type of shake is if you had a cow's milk protein allergy. So on the other side, if you're looking to lose weight or to maintain weight, these are some examples of shakes of oral nutrition supplements that can help you meet those goals. These bottled beverages have about 150 calories and about 20 to 30 grams of protein per container. So these would be considered more of a snack. Again, these are, no one option is better than the others. There are just some different ones you could look for when you go to shop. The only thing that's different is the two listed at the bottom, the Ensure Clear and the Boost Breeze, are what I like to call like fruit juice version of your protein shake. So they actually are not creamy or milky at all. They look just like fruit juice and they taste like fruit juice, but they've got some added protein in them. So these are specifically good if you've been told at any point you need to be on a clear liquid diet or you're nauseated. Sometimes these clear liquid protein shakes work a little bit better. So if you prefer to do a plant-based oral nutrition supplement option, there are some pre-made options out there that you can buy that are already in a carton. One is called Cake Farms. You can actually only get that one online. That's the only catch with that. Orgain and Ensure Plant-Based. These all use mainly pea protein, PEA, pea-based protein as the protein source in those shakes. So really, there's so many options out there. No matter what you're looking for, you should be able to find something for you. These are some, this is just what the Cake Farms looks like. Because you have to get it online, I wanted to show a picture, just so you know if you are at the right you're at the right website if you see what it looks like. Now, if you have diabetes, or if your treatment for some reason has caused you to have hyperglycemia, and your physician or dietitian has told you to kind of watch your carbohydrates, or if you've been told to be on a specific carbohydrate controlled diet, these options listed are carbohydrate controlled shakes that help to control your blood sugar levels. They also are good for people with diabetes or anybody that's had a previous history of gastric surgery that can't tolerate foods with added sugars very well. So Glucerna, boost glucose control, and then you see the Premier protein a lot these days. It comes, in many different flavors. But again, these are going to be more of your, these typically are found to be about 150-ish calories with, 16 to 20 grams of protein per shake. So again, this would be kind of more as like a snack type meal during the day. It's not going to be as high calorie as the full meal replacer oral nutrition supplements. But again, these have different things in them to help control your blood sugar levels. So a lot of times people want to make their own protein shakes, and that is perfectly fine to do. We typically recommend, if you're going to do a protein powder, to get something that's 100% whey protein. This is just pure protein powder that comes from cow's milk. It doesn't have any extra additives or ingredients in it. So you can typically take that protein powder and mix it with your liquid of choice. Usually we recommend milk to kind of make your own shake at home. They also have plant-based protein powders available. Again, we typically would recommend like a pea protein or something along those lines versus a processed soy protein. And then you can look, again, back to the nutrition label. You can look and see what the scoop equivalent is. But if you're wanting to make kind of your higher calorie, higher protein shake, you can see what the scoop equivalent of kind of 30 grams per serving would be. We typically don't want you to do more than 30 grams of protein per serving. It can just be hard on your kidneys if you go over that. So that's why we kind of just say to stick to the 100% whey or plain pea protein, and try to avoid things that may be marketed towards like weight gain or stuff like that, because you may end up exceeding your protein needs, which can kind of be, again, hard on your kidneys for some people. So, as we were talking about oral nutrition supplements, I didn't want to forget about the products that we recommend to help people to get through their treatment based on some side effects that can come up with different chemotherapy or radiation therapy. So these are some wound healing products that can be beneficial to you if you have any different symptoms or non-healing wounds. The first one is Juven. It is a powder that you mix with water twice a day. It comes in a packet, and you just pour the packet in, 8 to 10 ounces water twice a day. It has glutamine, arginine, vitamins and minerals, and collagen, as well as it has like vitamin C and zinc in it, just to help with wound healing. So these are good if you have like a surgical wound, or if you have any sort of radiation wounds, once you're done with radiation, again, that's where Juven can help. The next product is something called Helios. It's a glutamine powder that we sometimes recommend during radiation to help prevent mouth sores from occurring. Also, if you're on a chemotherapy that may have mouth sores as a side effect, this may help with the mouth sores on the inside of your mouth. And then finally, there's a beverage called Interade. It is a beverage to aid with chemotherapy and radiation associated nausea, vomiting, and diarrhea. So what it does is it helps to kind of heal your gut on the inside to help slow down those radiation and chemotherapy side effects that you may be having. All the Juven, the Helios, and the Interade, typically you can find those online. If you just Google the names, you can see where to order them. But just, I didn't want to forget about the other products to help kind of support you and kind of the healing side of things as you're going through treatment. So this is just a little example. The Helios is the powder. And then BioLite is a new product that came out. You can get it really anywhere. You can get it on Amazon. You can get it at the grocery store, gas station, anything like that. It is marketed as an IV in a bottle. So it has more electrolytes and ginger and things like that to help make you stay hydrated if you're struggling with dehydration as a side effect. And I know sometimes water can just get boring. So, your electrolyte beverages can be a good way to help make sure you're staying hydrated. So to switch gears, we've kind of talked about all the pre-made shakes. But now I kind of wanted to get into talking about juicing and smoothies. So one benefit is that the juicing and smoothies can provide and even maybe increase your intake of fruits and vegetables in your diet. So if we think about juicing, juicing is the natural fluid or liquid part of a plant, especially with fruit. So if we're juicing something, then that's actually extracting the juice and removing the pulp. So if it's 100% fruit juice, so that would be not just you juicing yourself, but even if you were to buy something that was pre-juiced, a serving size is only 1/2 cup or 4 ounces. So that's really a small amount compared to what we kind of think when it comes to like what may help us quench our thirst. So that's where I tell people you just kind of have to be mindful if you are drinking 100% fruit juice and you're especially looking to like monitor your blood sugar levels or things like that, that 4 ounces is really what a serving is. The benefits of juicing, it can be beneficial for people who can't eat a lot of fiber due to bowel surgery. It's a great way to get in fresh fruits and vegetables. You do get the vitamins and minerals most of the time. And then, sometimes blended version of some foods don't taste good, but usually juicing with the fruits and veggies, you can get it to be pretty tasty. There are a couple drawbacks to juicing, unless you have one of the really fancy juicers at home that actually keeps the fiber and pulp in the juice. then you're extracting that fiber and pulp, which is where a lot of times you have obviously fiber, but you get some essential kind of phytonutrients, vitamins, and minerals are located in that fiber too. Without the fiber, again, you're drinking the calories, but you aren't necessarily getting the fullness that you might have from eating a whole fruit or vegetable. So you may be kind of left feeling a little bit hungry after you drink the juice. Back to kind of talking about the calories that, small serving of fruit juice does have calories in it. So if you were to drink a whole larger serving of fruit juice, then those calories can add up, especially if you're looking to lose weight or if you're watching your caloric intake for your nutrition goals. That's just where sometimes people can find extra added calories into their diet. If you're looking to gain weight, sometimes juice can be a way for you to add extra calories into your diet. And then, finally, there really isn't any evidence that supports juicing to help cleanse or release toxins from your body. It's, the fruit juice is going to have a lot of antioxidants, vitamins, and minerals, but there's nothing that has come out yet saying that it's a detox in any way. So smoothies are a thick beverage that contain pureed fruit and a liquid. So smoothies typically use the whole fruit or vegetable. So you're getting the fiber, the vitamins, the minerals, and the phytochemicals. So nothing is thrown away. So a lot of times if you are juicing, you extract the pulp and the pulp gets tossed in the trash. But with smoothies, the smoothies are gonna incorporate the whole fruit or vegetable. The suggested serving size for a snack is 8 to 12 ounces. And the suggested serving size for a meal replacer as a smoothie is going to be bigger. So that's going to be like your 12 to 16 ounces. So I pulled up some different Smoothie King options just so you can see the difference in, what you're getting. So you can see most just this one shake, the Slim blend has 250 calories compared to the Wellness blend that has 680 calories. So the one thing that I kind of wanted to the one thing I wanted to point out here was that if you do go to a smoothie shop or somewhere that's making your smoothies, it's important to look at the nutrition info, because these are all the small size of your smoothies, and you're getting a wide variety of different amounts of calories and protein and carbohydrates. So that's why it's important to it's totally fine to go get a pre-made smoothie because, we don't have time sometimes to whip it all together. And if you're out and about, sometimes it's easy just to go grab a smoothie or grab a shake. So this slide just kind of is helping you to make sure that when you go into one of these places, you kind of look at the different calories, protein, things like that, because just depending upon your personal nutrition goals, even though it sounds tasty, there may be one that's better suited for your needs. Like I talked about with the juicing, smoothie benefits is a great way to get in fruits and vegetables. You also get that protein source in a smoothie that typically with juicing you don't have added in there. It's good for a breakfast snack or like a little dessert. It's easy to prep ahead of time. So one thing that we'll typically recommend is if you have like a bigger batch of fresh fruit or spinach or anything that you might eventually want to put in your smoothie, to go ahead and pre-make individual freezer bags of your ingredients, so that you just have to pull out a freezer bag of ingredients and put it in the blender with whatever liquid or and protein source you want. So then that kind of helps to cut down on prep time. Also, like for instance, sometimes maybe you might have like a banana that you aren't going to be able to eat before it goes bad. Well, you can go ahead and just throw that in your freezer. And then when you're ready to make your smoothie, you can pull it out that way. Frozen fruit is just as nutritious as fresh. So again, you can always buy frozen fruit in the grocery store and just have bags of frozen fruit ready to go, so you could make a smoothie whenever you needed to. Again, it just kind of depends on what your personal nutrition goals are. But some of the drawbacks can be that it can be, higher in calories with a lot of added sugars. If you think about if you're making a bigger serving size of a smoothie, you may put 3 different kinds of fruits in there, different ingredients as well. So you just kind of have to make sure that I always try to put some sort of green in my smoothie, a protein source, just to kind of help make it a balanced meal. And then for those of you who need to control your carbohydrate intake, if you do have diabetes or you were told you need to watch your carbohydrates, just kind of be mindful of smoothies. You may just need to focus on doing a smaller portion size of the smoothie instead of like a big cup. And then also, again, making sure that your smoothie has a protein source, and again, just maybe a smaller, more portion controlled size. So some tips for making smoothies. You want at least a third of it to be vegetables. So that's like greens, celery, cucumbers, carrots. These are going to be kind of your non-starchy vegetables that are going to help add a lot of phytonutrients as well as your good fiber. For as far as the fruit goes, we talked about freezing fresh fruit in individual bags. You also can buy the pre-frozen fruits from the grocery store: berries, bananas, oranges, peaches. You could also use canned fruit if you have canned fruit at home. I would just look for the unsweetened version so that you can control the added sugars that are in your smoothies. So, you really want the fruit to be your sweetener. And then, usually we recommend using some sort of like either dairy milk, soy milk, lactose-free milk that contain calcium and vitamin D, as well as your protein as your liquid base, again, just to give it some more protein. And then sometimes, spicing it up by adding ginger, turmeric, or cinnamon to your smoothies can help give it different flavor. Also, ginger can be good for nausea. And turmeric is also another kind of anti-inflammatory spice to use as well. So don't be afraid of adding different spices in. You could do like mint or basil if you had some of those on hand as well. So some people do ask if smoothies can help lose weight. And really, it can be easier or harder depending upon what you're putting in your smoothies. Like we were talking about earlier, really trying to limit, for those of you that are looking for weight management with your smoothies, avoiding adding sugars, using like a plain Greek yogurt is a great way to add protein in smoothies, without adding added sugars. And then kind of on the flip side, if you're looking to gain weight, with a smoothie, ways to add more calories would be using things like high fat ingredients like peanut butter or avocado. Those are great ways to boost calories in smoothies. So, again, the best practice is to try to make your smoothies at home. And for your kind of, if you're looking to do smoothies as a meal, about 300 to 450 calories, and then snacks are about 150 calories. So it, just kind of understanding how to make a balanced meal with a smoothie. Juicing is more so for just a kind of different beverage to drink, but a smoothie would be more of like your way to do like a meal replacer or a snack replacer during the day. These are some examples of, these are both the breakfast smoothies, pretty high calories. You can see it's about 600 calories and 17 grams of protein. It does have a Boost Plus in it. So that's where about 350 of those calories come from. So if you're looking for something that was a little more low calorie, you could substitute like a just regular protein shake, or even like some plain Greek yogurt and milk or something like that. So there are ways to kind of switch things up. And then the purple power smoothie has blueberries, flax seeds. It actually uses silken tofu in it as the protein source. So this is kind of a different way to use tofu during the day, of your like, and then the half cup liquid base would be like water or milk, any kind of thing like that. And this one's about 263 calories. So this could be considered more of like your snack style, well, more like a lighter meal. And you can always kind of make your smoothie, and if you don't want to finish it, you could either freeze it in a container by itself, or sometimes people will take like a ice cube tray and pour the leftover smoothie in the ice cube tray, and then that makes it easier to kind of like pop out, maybe add a little bit more liquid, and then re-blend it up. So I wanted to save time for questions. I hope that I've kind of given y'all some clarification on the different shakes and supplements that are out there. I'm happy to go back to any slide if you wanted to look at anything. But thank you all so much for having me.
Thank you, Mary Parker. I appreciate it.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.